You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures. According to my first guest, get a fixed set of teeth in just a few appointments. With us, we have an expert on the topic. He is an oral surgeon, Dr. Peoples. Dr. Peoples, welcome to the program.
Thank you very much.
Now, do you think that's the future of dentistry? You know, when we say no more dentures, that everything will be kind of attached maybe
I
to
hope
dental
so.
implants?
I hope so. And the reason being is that there's no need to suffer with walking around with dentures.
Okay.
You can basically put implants in and make a nice stable fitting denture that doesn't move around. And that's what I'd like to do for patients if we could.
So before we get into today's topic, I've got a lot of questions. Your practice, who's the typical patient? And as an oral surgeon, what are the things you do?
Where do I begin? I see a significant number of patients from other patients or referred to us from a group of dentists that we work with.
So 99% of all the patients that you see come from general dentists.
That's
Is that
correct.
Right? They refer to
That's
oral
correct.
surgeon. Okay.
And of those people, we typically see them for extractions,
All right.
specifically of wisdom teeth or third molars, or also of teeth that are broken down and non-restorable, which allows us to segue into how do we replace them. And the means by doing that typically today is by dental implants.
Okay, good. Now you've been in and around dental implants for quite some time.
Yes, I have.
Is that right?
Yes.
And trained, I guess, under one of the pioneers, Dr. Peter Moy.
Right.
Says here at UCLA.
That's right.
You head up a study club.
A study club is
tell 'em about that.
the study club has been around for approximately 15 to 20 years.
In Houston?
In Houston. It has a group of dentists that meet monthly, and we have speakers that come in and discuss implant topics.
Is there really that much to talk about, by the way?
Oh, yeah.
Really?
Absolutely. Absolutely.
So what is it, by the way, that what used to take you with dental implants, what used to take you 9 months or 12 months, why is it that you can now do it, in a few visits? Or even on the same day, as you say?
A lot of the science in this has changed significantly. Implant surfaces are now different than what they used to be, which allows us to be able to have faster healing periods than was previously known.
Okay.
In addition to that, from a surgical standpoint, the really big thing that's helped us is imaging, meaning the x-rays and technology that go into the preoperative view of what it is we're planning on doing. Before all this was around, effectively what we had to do was open the gum up and look to see where we had available bone. That's no longer an issue because the imaging allows us to be able to take a lot of the guesswork out of what it is we're planning on doing.
As an oral surgeon, by the way, were you doing like bone grafts from the hip?
Initially, yes.
So that's behind you?
Well, not completely, but for the most part, yes.
But for the standard denture wear coming in?
For the standard denture wear, pretty much, yes.
You say pain is not, not something they complain about?
It's not something that they complain about a lot.
Okay.
And typically, the patients are off of their pain medication within a day or two at the very most.
Okay, you said that one person went to school the next day.
Yes, I did. I had a patient.
Student.
Yes, I did. He had a tooth removed, an implant placed. I called his mom to check on him. I said, "Where is he?" And she said, "He's at school." He went to school that very day after we had placed the implant.
So this term teeth in a day, that's real?
Yes, it is.
Is that
potentially?
Right?
Yes, it is.
Okay.
Yeah.
And not everybody's a candidate, obviously. They have to go in.
That's right.
And meet with them. Now,
Right.
do they need a referral to see an oral surgeon for dental implants?
Well, not necessarily. I mean, we'll be happy to consult with anybody if they think they're
so
candidates.
So they could go to you directly?
Absolutely.
As well. And then you'll work with a local general dentist?
Yes, we would.
So I understand.
We have a group of people that we work with who do the restorative end of the procedures.
Does it cost more to go to a specialist?
No, it doesn't. Our fees, I think, are probably in line with what everybody else charges.
Everybody else is doing. People, we had a discussion in the green room. I say, my website, wellnesshour.com. It's, in fact, even today, it's a real interview. I'm not endorsing you. I'm just asking the questions. But people will say, who should I go to for this? Who should I go to for that? They email us. And I would say, find a specialist. So, if it's about the same, might as well go to an oral surgeon, I think. Is that right?
I think that's
do you have a bias? Do you feel like go to an oral surgeon?
My personal feeling is that due to the level of training that we've had, particularly in regards to bone grafting and dealing with potential complications that patients may have, I feel we're very qualified to be able to handle those
you do
issues.
a lot of surgery. You do from cancer patients, rebuilding jaws,
That's right.
cleft lip and palate.
Yes. We also do corrective jaw surgery, which is known as orthognathic surgery, to correct bites that are off.
Okay.
We treat patients who have facial infections. We do oral pathology and biopsies and surgical repair of those issues. We also treat TMJ patients.
Is that right?
Oh, yeah.
Now, are you working alone there?
Yes, I am.
Okay. And so you're pretty busy guy. So dental implants, let's move right into dental implants. So
Okay.
what are the different categories of dental implant patients you see?
The categories of the patients range from a person who's missing a single tooth
All right.
to multiple teeth to an entire arch or an entire mouth full of missing teeth. And we can replace them as a single tooth, or we can replace them for a denture, or we can give them all their teeth back if they choose to do that.
Okay. Now with, and we were talking also in Houston, because I looked up on the internet, 20
Right.
million people in the U.S. have an upper or lower denture. That's hard to believe, by the way, for me. Now, in Houston, there's got to be 10,000, tens of thousands of people wearing dentures.
Well,
Right.
that may be true. That may be true.
Now, if it's so good, dental implant, you're saying with just 2 implants, you give them something secure,
Right.
snap in, snap out.
Right.
Why aren't they all doing it? Why aren't all the denture wearers doing it?
I think to a certain degree, the people who are missing their teeth have quit going to the dentist.
Okay.
Consequently, they don't really know what their options may be. And I think there also may be some fear that was attached to previous procedures that they had, fear of pain preoperatively, fear of pain after the surgery. And I think that may shy people away from actually wanting to pursue any further treatment.
An expense?
Expense is also a potential issue as well. They figure, well, I've already gone through and had my teeth removed. I have a denture. Why should I spend any more money on any more treatment?
But like you say, I mean, do you think people count their teeth and think, boy, I can't afford dental implants? You're saying with just 2 implants.
Yeah, with 2 implants, effectively what we can do is increase the stability of the lower denture. That's the biggest bugaboo of people that wear dentures. And the reason being is that unlike the upper denture, which has some stability against the roof of the mouth.
Because of like suction, right?
Right, like suction, the lower denture doesn't have that. The tongue is constantly moving against it, and it's effectively just floating. So what 2 implants allow us to do is effectively stabilize the denture so that movement is greatly reduced, which significantly improves in a lot of
So
self-confidence.
no more adhesive.
Adhesives
if you were to do the 2 implants.
Adhesives are essentially a thing of the past with the implants. And the more implants, the more stability. So if we have an option to be able to do, let's say, 4 implants there, we can potentially give them something that's fixed.
Okay, so when we say
Meaning
no,
it doesn't come in and out.
so it's really a full arch of teeth, a full set of teeth
That's
with
right.
those 2 implants.
That's correct.
Snap. And what can they eat with those, by the way?
I think they can eat pretty much anything they normally would eat with regular teeth. Mind you, they're not going to be as stable as they would do if you had, let's say, 4 implants.
Okay.
But in terms of the stability of the implants holding the denture in place, you're not going to see them flopping out on the table at the time you're having supper. And that's what we're trying to improve.
Now, these people, by the way, you brought up a good point earlier about one of the reasons why these denture wearers don't do it. They're afraid of the dentist, right?
Right,
And
yeah.
especially they're afraid of the oral surgeon.
Yeah.
Right?
Oh,
Do
yeah.
they
We're
say
the
that to
bad
you?
guys. Sometimes they do.
Nobody likes going to the dentist.
Sometimes they do. But,
What do they say when they say it to you?
oh, how much is this going to hurt?
Do they say, no offense, doctor?
Yeah,
but
oh,
hey,
sure. I don't, you're the last guy I want to come to see to have this done. But in reality, part of the beauty of what we can do for the patients surgically and at the time of surgery is to provide anesthesia for them to make the procedures very comfortable.
Is that right? So you do IV sedation, oral sedation?
We have a group of nurse anesthetists that we work with which provide that. And we also have an anesthesiologist that we work with as well.
Is it true they don't even remember the procedure sometimes?
Sometimes, but typically those who remember don't remember much, nor do they really care.
Okay.
Okay.
All
So
right.
they're feeling pretty good at the time we do
Is
these.
this the happiest? I mean, look, you do a lot of oral surgery, but the dental implant patients, the category of dental implant patients, let's say the denture wearers, they now get a fixed set of teeth in their mouth. Is this
Right.
the happiest group of patients in all dentistry that you see?
I think they are. I think they are in that we've been able to take them from a place where they didn't have teeth to now where they have teeth. And that's whether it be a person who has a denture or even a single tooth replacement. They all seem to be fairly comfortable and happy with the results.
Now we say there's thousands of people in your area that have dentures. Is there such thing as a happy denture wearer, by the way?
I
know a few, they don't complain.
I think a happy denture wearer is somebody who's wearing a denture that doesn't move around a lot.
Okay.
That is something they may not be very used to, especially if they've had a denture for a long period of time. So this is a dramatic increase in their ability to function, their ability to chew, their self-confidence in terms of how they speak to people, and not having to worry about stuff as much as they may have done previously when they're wearing a denture.
What are the age ranges of the people that are getting this done?
The age ranges extend from late teens all the way into the 90s.
90. What's your oldest patient?
Oldest patient's probably, I think, about 89 years of
89
age.
years. Now, why would an 89-year-old want to get dental implants?
Because they want teeth.
Okay.
They don't want to walk around without teeth any more than you or I would. That's why. And they, they're healthy. They're going to be around for a while. They want to enjoy life when they have it.
You want to be able to eat and chew.
Absolutely.
But you say with 4 implants, you get a fixed set of teeth. You could.
You could. Absolutely.
And with those, you could eat whatever you want?
And yes, you can. And pretty much immediately.
Really?
This is an example of a patient.
Okay.
Of a patient. This is a model of a patient.
All right.
Potentially, who has 4 implants. You can notice the way the implants are designed here in the back.
At this. It'll be tough to see. We'll try to get a close-up of this. If you could take a look at this. Okay, so 4 implants, and they have a whole arch of teeth.
A whole arch of teeth, and these are inserted at the time of implant placement.
Okay.
Now,
that means you place the implants, but the teeth are right on top.
The teeth are right on top at the same day. Now, we have other patients that we place 4 implants in, and that supports a denture, which does not have an upper palatal coverage.
Okay.
And those are usually the types that can either be removed or they can come out on their own. So for the upper,
you could still 4 implants, snap in, snap out, or fixed.
Or fixed.
I mean, doesn't everybody want fixed though?
Not everybody. You'd be surprised.
Okay.
Some people don't, and that's okay. That's
It's
their option.
a little bit more money to go with the fixed.
A little bit more, yes.
Okay.
Okay. Right.
Now, dental implants aren't really covered by insurance. Right?
That's right.
Medicare, things like that.
That's right. Some insurance coverages are available, but they typically don't cover the entire cost of the procedures. However, we, as a practice, are committed to trying to help our patients as much as we can.
Like finance plans, things like that?
Right. And we have finance plans which we can work with the patients to help them hopefully gain what it is they came to see me for.
And by the way, so somebody's watching this today, because we said you could get a fixed set of teeth, permanent set of teeth in just a few appointments.
Right.
So if they go in and meet with you today or tomorrow, they're watching this, they see you tomorrow.
Okay.
They get x-rays or the CT or whatever. How soon before they can get their teeth?
Well, it depends
I mean, if everything works out perfectly.
If everything works out perfectly, potentially that day. Potentially that day.
Well, don't you have to send out and get the teeth made?
Well, not necessarily. It depends upon
Really?
the type of procedure we're doing and what they're there for. But in general terms, patients will have some teeth when they leave. If we have to provisionalize them, in other words, give them something temporarily while the implant's being in the process of healing, then they will get that immediately.
Okay.
And we try to arrange that through the dentists that we work with.
Okay. When it's all done, by the way, are these the kind of people that say, I should have done this years ago?
I think so, yeah. Yeah, I think once they have the teeth in their mouth, they're very happy about that. And they're very comfortable with the idea that they went through with it.
Now, is it true you can use their own denture and kind of put some snaps in there or something?
Sure.
Attach them to...
If we were to place 2 implants in the lower jaw, let's say for a person who's been wearing a lower denture for a long time, which is very ill-fitting, and typically the easiest means of doing the restorative end of this is to take the denture, hollow out some areas underneath the denture on the inside of it, which will allow the denture to fit over the top of the implant. An example of that would be right here. Now,
okay. Are you exaggerating a little bit right there? It's that hard to pull
If I can
off?
get I wish I had fingernails.
Okay, let me try.
Hang on. There you go.
Does that ever happen to patients, by the way, where they can't get it off?
Initially, yeah. Their biggest complaint is, how do I get this thing out of here?
Is that right?
Yeah. And
how many implants is that?
This is 4 implants.
And that's a snap in,
but you
snap
can
out.
do snap in, snap out, but you can do as many or as few, rather, as 2 of them, and to give you a nice solid result as well.
Okay, and we talked about if you were, I know this can't happen, but a try-in period. You said, okay, denture wearers come in on a Friday, give you just 2 implants. You said on Monday, nobody could go back to their loose-fitting denture.
I don't.
Do you believe that?
I can't believe that anybody would ever be used to the idea of a denture that does move a lot. I mean, wouldn't you really rather have your own native teeth or something that's very close to that, as opposed to something that you have to adapt yourself towards in terms of not only social interaction, but just basic chewing?
Interesting.
Yeah.
You know, I don't know if I told you, my father, 77 years old, just got his dental implants, 2 on the bottom.
No.
He's a trumpet player. And he said, and by the way, I know we're not supposed to say painless. According to him, 0 pain. But he can play the trumpet much better. Because, you know, the forces, I guess, against the lower, no pain, feels good, and says he wishes he would have done this years ago.
Oh, yeah. I can believe that.
Interesting. So a lot of people, so 89-year-olds now you run that study club. What's the oldest dental implant patient you've ever heard of?
The oldest one that I've heard of is 95 years old.
95. Now, now on the 89-year-old that you did you get a little nervous?
No, not really. No. The only anxiety, if you like, associated with operating on somebody in that age group is just to make sure they're healthy enough to maintain their ability to go through the actual procedure and anesthesia.
So even with a little osteoporosis or whatever, people could be made candidates. Because if you're 75 years old, you have a little bit of osteoporosis, right?
If the patients who are coming in are on bisphosphonate medications like Actonel, Boniva, Reclast, those kinds of medicines, typically what we like to do, if at all possible, is to stage the procedures, remove the teeth, and have them grafted first to find out how they heal.
Okay.
Because as you know, these medications can sometimes create issues with delayed healing in the jaws.
Interesting.
The normal protocol for operating nowadays in that realm is to have the patients off the medication for approximately 3 months.
Okay.
Do the procedure, wait for an appropriate healing time, and then start back on the medication again. If there are issues with healing, we want to make sure that we keep the surgery to a minimum.
Okay.
And obviously that's also done in conjunction with consultation with their doctors.
Okay, good. Now, do you think people think, you know, you mentioned 89 years old, 95 years old.
Mm-hmm.
Do you think some people, denture wearers watching this, that's one of the reasons they don't do it, because they think they're too old?
Yes.
They self-diagnose and say,
sure.
I don't have enough bone.
I don't have enough bone, or I'm too old to get this.
Have you ever had somebody come in and say they were told they didn't have enough bone?
Oh, yeah. Part of the beauty of continuing education, specifically with working with Dr. Moy and also through the Academy Osseointegration, is that I've been exposed to some leading edge technologies which allow us to redo or regrow bone, where in previous times it may not have been possible.
So the patients do you think there'll be a trend where the patients start getting older and older, meaning people are starting to get the word out?
Yeah,
come in?
I think so, because the procedures that we're doing now are less invasive than they used to be, meaning that we don't have to go in and remove hip bone or even take bone in certain instances from other places in the mouth to be able to reconstruct jaws that otherwise couldn't have bone.
I mean, when you say you do surgeries on a computer, what does that mean?
What we're doing is virtual surgical planning with the patient's jaws to be able to simulate what the surgery is going to be like.
Okay.
It's like flying an airplane in a simulator. We're able to determine where the implants need to go and what structures under the gum that we're looking to avoid. We can also determine what the quality of the bone is we're planning on putting the implants in, which allow us to be able to structurally give them a really solid result.
Now, is it true, by the way? I mean, you guys have guides, like a guided surgery, where it's like goes over their gum line and there's holes in there in some cases.
Right.
You just go right in there.
Yeah. The procedures that are done virtually on the computer are transferred by CAD CAM or by the computer to a solid three-dimensional model, which is then taken and placed into the patient's mouth at the time of the procedure to allow us to give the exact positioning of where we want to place the fixtures.
So the patients that get, so the denture wearer comes in, they have one of these teeth in a day or all on 4 in the same day. How soon can they eat?
If it's an all on 4 technique, meaning 4 implants with an immediate fixed denture.
Teeth that don't come out.
Teeth that don't come out.
Okay.
You can eat after the anesthesia is worn off, which essentially means that evening.
Really?
They can be loaded immediately. Some do.
Okay.
Some are a little bit more adventurous than others.
Do you like them to wait about a week?
I personally do. Yeah. I would prefer to kind of increase the density of the food after they've gotten used to the idea of having teeth that are not going to be coming out.
Now, if 70 is young today, no doubt about it. 75 is young today. And, everybody knows you got to have a lot of fiber. Well, it's hard to eat broccoli and carrots and things like that, vegetables, if you have a denture.
That's true.
Right?
Especially if you have one that moves around a lot.
So this will allow them to do all that.
It increases their ability to do that significantly.
How miserable are denture wearers, by the way? When you hear some of the stories they come in, what do they tell you?
Miserable, sometimes pain, meaning that, this denture rubs against my jaw down here and it hurts because it doesn't fit well. But I think miserable also means not being really comfortable in social settings, having circumstances where are my teeth going to come out?
Like dating. I mean, people are dating at 75 on Match.com.
Having to deal with all the glue that you have to put in there to hold the dentures in place. I mean, who wants to do that? Okay. That's just miserable. That is miserable.
Is there a tipping point that you hear every once in a while where they say, this happened and I had to do something about it? Do you ever hear any of that?
Yes, I do. Oftentimes it's not. It's the spouse that's telling them, that's enough of this. I'm tired of you complaining. Go in and get this fixed.
Is that right?
Oh, yeah.
Okay. Now, do you encourage that?
Sure.
Bring in the spouse?
Absolutely. Because I think it's a decision that may affect both people, and I certainly like both of them involved in the consult.
Now, the other category of patients, people that have been told their teeth have to go. Okay?
Right.
Their mouth's a mess.
Right.
They all have to be it's a choice between dentures or dental implants. Always get the dental implants, you're saying.
I think dental implants offer many more significant options.
But what if their gums are bad, by the way?
Once the teeth are out of there, the gums are going to heal.
Okay.
Once the teeth are gone, the gums get better. That's the bottom line. So, and implants don't decay.
All right.
Okay.
All right.
So if we are able to replace what they have with either all their teeth or bridges or dentures that don't come out, like you said, that stay in place, and this gives them functional and aesthetic results that they're looking for, hey, we got a real winner there.
And they look good, too. I mean, you can make them look like a beautiful set of teeth.
Yes.
Okay, now what is this? This is pretty graphic, by the way.
And this is a fellow that I saw approximately a year and a half ago.
Is that common? I mean, what's going on there?
It's more common than you think. You just don't see these people because they're afraid to show their teeth.
Okay.
They don't want to show what they have in public. So, as a result of his particular circumstance, he was referred by a doctor that I work with, and we were able to help him out.
So what did you do for him?
What we ended up doing was removing his teeth. We saved a few. We were able to save a few of them, but we removed a majority of them and replaced them with implants. And now he has fixed implants, meaning crowns and bridges that don't come out, that have completely replaced what he had that was destroyed.
Now, people like this, by the way, in this very graphic photo, you say it hurts to chew, a lot of bleeding.
Bad breath, bleeding, soreness, continual pain, embarrassment. They don't want to be seen.
Do people hang on to their teeth too long in certain cases?
In certain instances,
like this?
Yes. In this particular case, the longer those teeth stay in there, the more bone loss you're going to experience, which starts limiting how much our options are in terms of being able to replace them with regular teeth again.
Okay, so in a case like this, when it's all done,
right?
This guy's got to be happy.
Oh, he's ecstatic. He's ecstatic. He told me that for the longest time, he knew he needed treatment, but he's ashamed to admit it. And now that he's had this done, he's smiling more, he's more active physically, he's more involved with his spouse. He's basically an individual who's come out of his shell, and he's very, very happy with it.
Now, we are out of time, but let's give a recap for the denture wearers, because you say no more dentures, get a fixed set of teeth in just a few appointments.
Right.
So show us the models again and what the denture wearers, and do you show these to the patients?
Sure, absolutely.
Okay.
I think that seeing pictures and models are a lot easier to explain than doing it verbally, at least for me.
Okay.
We can do as few as 2 on the lower, which would be placed in roughly at the corners of the mouth, which would help stabilize
Snap
the
in,
lower
snap
denture.
out.
Snap in, snap out. We can place more than that. And again, I'm having trouble pulling this off. But
Is
essentially,
is that an accurate model? I mean, it
this
could
is a
be
very
that tight.
this is a
Let me
very
see this.
accurate
Let me see
model.
this.
It's very tight.
Now this is not. You're not okay. I'm able to pull it off because I take it from an angle.
Okay.
With this,
Yes.
this is like 4 implants.
4 implants with a denture snapping in over the top.
Okay.
Now,
can show that
sometimes
snap.
that denture can be screwed into position and be removed by your dentist, or placed in and not removed, such
Like
as
that.
this. And in this case, basically, these teeth are being delivered on the same day that the implants are being placed.
And that's at teeth in a day.
That's right.
All on 4.
All on 4 teeth in a day.
concept.
That's correct.
So what about maintenance with that? Like a water pick,
A water pick,
brushing.
yeah, electric toothbrush or
They
water
don't stain.
pick. Well, they stain just like your regular teeth would.
Okay.
But no different. Initially, there's a temporary denture that's in there for approximately 6 months, and that's replaced with a permanent one.
Now we're out of time. Final message to the person: either they've been told their teeth have to go, maybe they think there's no hope, but especially to the denture wearer. What do you say to them? Final message.
Final message is this. If you feel like you don't have options, I'd be more than happy to talk to you, because I think you do have options. And I think that if you're in a situation such as the picture this gentleman is here, we have options for you as well. And I'd love to have a chance to be able to sit down and visit with you on those.
Okay, great. And they can go to your website, find out more information.
Absolutely, yes.
And meet with you.
Yeah.
All right, good. I want to thank you for coming on the
Thank
show.
you.
Very interesting. Good
Thank
stuff.
you very much.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, you go to our website at wellnesshour.com and just put in Dr. Peoples' name. It's easy to remember, Peoples, and or put oral surgery Houston. You'll find it that way too. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.